I'm Dr. Haley Todsen, a board-certified emergency physician practicing for 20 years, a Menopause Society certified practitioner, and the founder of Optimize Integrative Health.
My name is Bailey. I am the family nurse practitioner here at Optimize Integrative. I have 7 years of experience in the medical field. I am functionally certified, and I love focusing on longevity within this practice, and we hope you enjoy this podcast.
Today, we are going to talk about what frustrates most of the patients that we see here at Optimize Integrative Health. Your labs are normal, but you still feel horrible.
Yeah, I see this so much in practice where patients just feel terrible and they go to their primary care physician. And what people don't know is that your insurance will only cover so many labs every year. So if someone goes to their primary care physician feeling terrible, they're only going to run a vitamin D, a TSH, which is your thyroid stimulating hormone. They'll check your blood levels, and they will check your kidneys, your liver, and your electrolytes, a fasted glucose, and a lipid panel, and that's it. So here at Optimize, we check that and so much more. If you think our medical system is reactive, if you have an abnormal level, they'll get more labs on you. But we are proactive, where our lab markers, our lab orders have over 63 biomarkers on them, because we look for what could possibly be contributing to those symptoms. So why don't you tell us a little bit about a lab marker that you see that a lot of people have, but they wouldn't know it?
Yeah. So one marker that we actually test that conventional medicine does not is ferritin level. So ferritin is your iron stores. This will actually decrease way before your hemoglobin decreases, which is measured in conventional medicine. We see this abnormal all the time. And why this is important is because you can have fatigue, you can have thyroid issues, hair loss, you can have low libido, weakness, poor gym recovery, all these symptoms, and never know the issue unless you check.
Absolutely. What is the lowest ferritin you've ever seen?
6.
No, you beat me.
Really?
Lowest I've seen is a 7.
Oh, okay.
Yep.
Very close,
Yep.
very close.
Yep.
And we like the level to be around 50, just so you're aware.
Minimum
of 50.
Absolutely.
So that is a huge difference. And a lot of times these will be women in their 20s who come to us and have no idea why they want to sleep all day, why they can't get out of bed, why they are so fatigued they're losing their hair. And so replacing this, usually it takes about 3 months to really see a significant change, where we will remeasure just to see where you're at, and they'll feel amazingly better. Simple
Absolutely.
fix.
Yes.
Simple fix.
Let's talk about how a primary care physician will only check your TSH, and what is that not telling us?
Right. So that doesn't tell us our free T3, our free T4, TPO. And so we look at all of this to look for different diseases like autoimmune Hashimoto's. We will absolutely miss this if we don't check. We're seeing a lot, again, young females with this. And this, again, is an easy kind of fix to support, at least we know what type of support you might need. The reverse T3 also, those are different levels that we can check and really dive deeper than your TSH.
Yeah. So when your primary care physician draws your labs and they just check a TSH, that is not necessarily what your thyroid is producing. So it is a hormone that comes from your brain in your pituitary and tells your thyroid to release more or less thyroid hormone. So in a perfect world, if your TSH is high, so remember, it kind of works opposite. If your TSH is high, that means your thyroid is not producing enough thyroid hormone. If your TSH is low, that means your thyroid is producing too much. But I have seen some cases where we get that full thyroid panel, and a patient has what we call subclinical hypothyroidism, where their TSH is very elevated, but their thyroid is keeping up with production. Now, if you were to go to your primary care physician and he were to just see your TSH level at a 6, he doesn't know that your thyroid is keeping up with production. He's just going to pop somebody on levothyroxine or delve into it further. Whereas we are proactive. We are going to really deep dive into why that TSH is elevated and hopefully prevent our patients from ever having to go on that thyroid replacement. So that's why I think a full thyroid panel right off the bat is so important, because it would really prevent a lot of unnecessary prescriptions.
Right, that's a great explanation. Something else that we do obviously is a hemoglobin A1C along with a fasting insulin level. So we don't just measure a fasting glucose level, we actually deep dive further than that. And that's because we know that insulin resistance starts 10 to 15 years before diabetes. So we don't want your levels anywhere near pre-diabetic. Remember, we're preventing disease. We're not treating disease. Conventional medicine waits till you get to that diabetic level to actually treat you. And that's what's so important. We know that insulin resistance can cause brain fog, weight gain, sleep issues, fatigue, hormone disruption, right? And so that's why it's so important to prevent disease. Our optimal levels are way lower than the normal levels even.
And that's why I like checking that hemoglobin A1C even on our younger patients, because that glucose on a lab draw is literally 10 seconds in your whole life, whereas the hemoglobin A1C is a 3-month average of how stable your blood sugars have been. And then circling back to being proactive with checking that hemoglobin A1C, I tell people get it checked at least once a year if you feel like you're low risk. Ideally, you want it checked every 3 to 4 months to make sure that you're staying at the same optimal level. And then same thing with the fasting insulin. So your hemoglobin can be normal and optimal, but if your insulin is too high, there's something going on in your body, and that needs to be looked into further, because extended elevated insulin will eventually cause your glucose levels to be in disarray and raise that hemoglobin A1C.
Right. Another lab that we check is homocysteine. Homocysteine is a toxic amino acid. This can cause damage to your DNA, your mitochondria, your brain health, and your heart. And so that is something that we measure. I know you really like to measure homocysteine also.
Yeah, that's a great inflammatory marker. I also love doing CRP, which is C-reactive protein produced by the liver. Our threshold for this is very low. I don't like anything higher than a 0.8 to 1, anything higher than that. And we do have so many people come in with elevated CRP levels. And again, we have to investigate and explore why that's elevated and what we can do to bring down the inflammation in their body.
Right. And so any other levels that you want to talk about?
Let's talk about testosterone for males and for females.
That's a good one. So we do measure testosterone total along with free and bioavailable. And that really breaks down for us what, particularly for you need help with. So men are different. We base basically on their symptoms along with their levels. So it's really important to have both. We do a symptom survey and replace as needed for that.
Yeah. In women, I see a lot that they come in and their testosterone levels are sub 10. And we do start with natural modalities first to help with that testosterone, but typically if a female is below a 10 and she's perimenopausal, I'll probably put her straight on testosterone replacement therapy because it makes such a huge difference in their lives. But I do love getting a testosterone level on women because it really shocks them with how low their testosterone levels can get.
That's very true. And it is so amazing when you replace the testosterone, how patients feel. They are less fatigued, they have more energy to show up for their family, their husband, even at their job, and really at the gym too. And they sleep better, their muscle recovery is better, and so overall it is a great replacement for these women.
Yeah, absolutely.
Yeah.
So that's our little bits and pieces of the lab panel that we check. That's not everything we check, but these are kind of the highlights and the big points in comparison to what you would get at a primary care physician. Like I said, we are proactive, not reactive in how we practice our medicine, because we are looking for what contributes to your symptoms and try to make that personalized plan based on your labs and symptoms to get you relief.
Exactly. So if you're tired of having those normal labs and want a deeper dive into why you feel the way that you feel, please contact us or your local longevity clinic to dive deeper into your symptoms. This podcast and all related content are provided for educational and informational purposes only. Nothing discussed on this show is intended to be, nor should it be interpreted as, medical advice, diagnosis, or treatment. No doctor-patient or provider-patient relationship is created by listening to this podcast, watching this video, or engaging with any of our content. Although I am a licensed physician and Bailey is a licensed nurse practitioner, we are not acting as your personal healthcare providers in this setting. The information presented is general in nature and may not apply to your individual medical situation. You should not rely on anything discussed here as a substitute for professional medical care, diagnosis, or treatment. Always consult your own physician or qualified healthcare provider regarding any medical condition, medication, supplement, or health decision. Never disregard or delay seeking professional medical advice because of something you heard on this podcast. Optimize Integrative Health, its clinicians, and its affiliates expressly disclaim any and all liability for actions taken or not taken based on the information provided in this program.